Hello, everyone. I'm Danny Ivan. I've been out for a while, and mainly because I got sick with COVID. And I'm here with my fiance, the nurse Kristen.
Hey.
And we're going to talk about our crazy experience with COVID in 2024 that took place in end of August and a little bit in September. So to start off, I believe I tested positive Wednesday, August. What is it? August 28th,
Mm-hmm.
and that's when I was starting to really feel sick.
Yeah. He was really feeling sick. And for someone that's never had COVID, that's the other thing to know is like since we've had COVID in 2020, this is the first time he's experienced it. So from when he got positive on Wednesday, he was feeling really blah the night before. We
Mm-hmm.
were at Costco shopping, and
Mm-hmm.
he was saying that he was pretty tired. He was pretty fatigued. He was just feeling that overall blah, lousy feeling. But then tell everyone what your first day was when you were positive. When I was like, you need to test for COVID. Because he's like, I
Right.
feel like I just have a cold. I don't think it's like COVID. I'm like, COVID has a lot of the same kind of symptoms. So tell
Mm-hmm.
everyone what you were experiencing on that first day when you were really sick.
Yeah, because like that Tuesday night at Costco, I was starting to feel like different, right? Like, oh, I think I'm coming down on something. But it does feel like a cold for sure.
Hmm.
And ever since COVID's been out, I've always tested to see if I have COVID, and I've always come out negative. It's not to say that I could have had COVID before.
Hmm.
I just missed the time frame of like, okay, if I tested the day and I was negative, but maybe the next day, if I were to test again, it probably could have been positive. Positive, but this time around, that Wednesday, I was feeling really sick. My symptoms were worse,
Hmm.
and I tested positive. I remember you tested me, and you looked at me like, "Oh my God, you're positive." So it was the first time I've ever been positive. Possibly the first time I've actually had COVID. I know plenty of people have had COVID, and they kicked it just fine. A lot of people got it. They were asymptomatic. A lot of people got it. They were sick for a day, and then they were good the next time. I guess it depends on the variant that's out there. I was hoping that I'd kick it right away because within that Wednesday, and then I remember Thursday, like towards the evening, I was like, okay, I think I'm good. I'm starting to feel better. Maybe next day on Friday, I'll feel better. No, that was not the case. It actually got worse. And then I ended
Hmm.
up with the sore throat from hell, which it felt like strep throat, but way worse. I never experienced such a
Yeah,
terrible
that
sore
was your
throat.
worst symptom. Was sore
Mm-hmm.
throat. And with this new variant in particular, with patients that I talk to now, that tends to be the worst symptom that they experience is that sore throat. And like Danny had mentioned, it's like strep throat. So if you've ever had strep throat, like really bad, it feels to that point where he couldn't even swallow anything.
No.
Like poor guy, I mean, he just wanted to not even swallow. Like he didn't
Mm-hmm.
want to have to eat, he didn't want to have to drink, which of course with
Mm-hmm.
COVID patients, you're pushing fluids all the time. He didn't want to do anything. And I'm like, oh, this is really bad. So
Mm-hmm.
then you had called the VA, had spoken with the doctor,
Mm-hmm.
and got you started on Paxlovid. So for
Mm-hmm.
any of you guys that have had COVID, especially if you had really severe symptoms, most of the time Paxlovid is really only prescribed for the elderly. So if you're 65 and older, or if you're younger and have a lot of comorbidities, so a lot of underlying health conditions. So if you
Mm-hmm.
have heart disease or if you have diabetes or anything of the sort, usually those are what Paxlovid is prescribed for. But his symptoms were really bad. I was concerned. So I was like, no, we need to get you started.
Mm-hmm.
Paxlovid is a 5 day regimen. So usually physicians always want to get you prescribed and put you on it within 3 to 5 days of onset of symptoms. So, like Danny, he had sore throat, he had fever. He had a fever of
Mm-hmm.
over 102 degrees. So that was obviously really concerning as well. So, got you started on Paxlovid. So, what was your complaint with Paxlovid that you told me when you took it?
I mean, there is an aftertaste to it, but
Very common.
yeah, I know a lot of people complain about the aftertaste, and yeah, it's there. It's unpleasant, but I had bigger problems to deal with. I was feeling really sick. I got hit with it hard, and then I was like, okay, I'm coming down from it. I'm feeling better, and then boom, like shot up again. That sore throat that lasted 2 days, and like you said, pushing down fluids. It felt like I was like every time I gulped, it felt like razors in my throat. It was so bad. Like
Hmm.
I avoided drinking water or anything because I just hated the agonizing pain every time I would drink water or anything. And especially medication. We took all kinds of medication. We took what?
Yeah.
Tylenol. We took NyQuil, Dayquil. Of course, the Paxlovid. I mean, there's all kinds of things we were taking, and just to get me to feel better, maybe break my fever. It's just crazy that here in 2024, COVID is just still around. And of
Oh yeah.
course, it's not like as crazy as it was when it first came out. And by no means am I saying like this is like still a crazy virus. It's still bad, but it's not as bad as before. We got better treatment now. We don't need to shut down, things like that. But the experience of getting COVID still sucks. You know, it's not fun. You know, it's just like any illness. You got to stay home and just try to recover the best you can. It's just going through that experience. It just wasn't fun. And, you know, and we still have lingering effects because you got it too, but I felt like
Yeah.
I got it worse.
No,
But
you definitely got it worse. And I think a lot of that too is just I've had COVID in the past.
mhm,
So, and it's quite funny because I had treated patients back in 2020 when the COVID had first hit, when we had the pandemic. And I worked with COVID patients within ICU and the cardiac unit. And for the 2 years I was in the hospital working with COVID patients, never did I get COVID, which is really funny.
mhm,
But then minus, another a year goes by or whatever, I had gotten valley fever.
mhm,
That was when you were still in Hawaii at the
yeah,
time.
mhm,
And I had valley fever, and then I had gotten COVID on top of that. And at that period, COVID was really a huge deal with respiratory issues. So if you had underlining like emphysema or COPD or asthma or anything like that, respiratory issues were a huge thing. And I had valley fever where I was having a lot of respiratory issues, and that just made it worse. So, yeah, I mean, when you take it from what COVID used to be back in the day to what it is now, like you said, I mean, they definitely have a surge, and we still definitely have a lot of patients in the hospital. And again, that's
mhm,
a lot of, your elderly or people that have it severe with a lot of other comorbidities.
mhm,
But yeah, like you said, we've got treatments now. We've got the Paxlovid that a lot of patients are on these days, and a lot of other symptomatic kind of helping measures to help with your symptoms. So, like for you, the sore throat was such a big deal. We ended up getting some lidocaine so we could make like a magic
mhm,
mouthwash to really
mhm,
help kind of numb his throat a little
mhm,
bit.
mhm.
Ended up not needing it by the time we needed that. But Chloroseptic Max lozenges, I feel like helped you more than
Yes, that was
anything
the
else.
best. That was the best. I know there was a spray bottle where you could shoot like the back of your
Yeah.
throat. Kind of numbs it a little bit. Like I barely felt it, but I added that with like the other medicine that you mentioned. What's it called again?
The Chloroseptic?
Chloroseptic. Yeah, that's why I
Mm-hmm.
can't remember it. But
All the medication names, right? A lot of people have a hard time naming, but yeah, I
but
mean, that
yeah,
helped you.
that
But
helped. That helped me with the sore throat. Plus, we had popsicles, ice cubes help, ice cream, like non-dairy ice cream help, like a sherbet. I had sherbet because you don't want to have dairy just because it adds mucus.
the
That
sherbet does have dairy. It's going to be the sorbet that
mm,
but yeah, I mean, any measure. So for any of you guys that have like the COVID now or get the COVID now really bad and you have that sore throat and you're like, how am I going to get rid of this sore throat?
mm-hmm,
Those Chloroseptic Max lozenges, super, super helpful. The Chloroseptic spray, like you said, you can try that.
mm-hmm.
Having the saltwater gargles also for
Oh
temporary
yes.
relief is actually really beneficial as well. So
Mm-hmm.
definitely doing something like that. Ice pack. I know when he was really bad, you had an ice pack that you
Yes, I
tried for a
did.
little bit because it was really bad.
I was desperate. That was for sure. And I remember just that Friday night, like I couldn't sleep because I don't know. I guess you gulp in the middle of the night or something. Like when you're
Yeah, it's just
sleeping,
that
it's just
natural
normal. Just
reaction
a
of like
natural,
swallowing your
you
saliva that
know.
it's yeah, you just don't even think about.
Yeah, and that was bothering me so much, and I couldn't sleep. And then you know, I decided just to sleep on the couch. But like it felt like every 10 minutes you're just gonna have like a small gulp of some kind, like your saliva, like you said, and it hurts so bad.
Mm-hmm.
So I just had catch and goes for sleep for like a good solid 2 days until I could have like some real rest until the sore throat finally went down.
Mm-hmm.
But that was rough. And I remember I was on my phone looking at Reddit forums, and a lot of people were experiencing the same thing, like the sore throat from
Yep.
hell. And it's just like, what do you do? I read all the recommendations: popsicles, ice cubes, ice cream, just
Hot tea,
mm,
honey. Yeah,
yeah.
just all the things. So like
Hmm.
the first couple days, that's what mainly what you were experiencing, and the intermittent fevers. So again, if you
Hmm.
have the intermittent fevers, you want to make sure you're using any Tylenol, any
Hmm.
antipyretic medications, a nice cool cloth over your head that is really nice. Anything like that is beneficial. But then you got other new symptoms after a few days.
So first was okay. the first 2 days, just feeling down, tired, fatigue, cold symptoms, and the sore throat. Um, After that, it's just coughing and congestion.
Hmm?
I remember that, and it still lingers now, but it's not as bad. But there was a lot of coughing, right? Yeah, that's right, because coughing was disrupting our sleep. If it wasn't the sore throat, it was the cough,
Coughing.
coughing in the middle of the night, and it's like a cough attack, just like nonstop coughing, until I had something to suppress it, like a Dayquil, Nyquil, something. A lot of cough drops. I had a lot of cough drops. I even
Halls
kept
with menthol.
I kept that in my mouth, even sleeping or trying to sleep with it. And then there was times where I was coughing so much I thought I was disturbing you, so I went back to the couch and
We did a lot of back and forth sleeping between the bedroom and the living room. Like he definitely had it worse than mine. I definitely, obviously, just being in close contact with him, ended up getting COVID as well. But like Danny said, I didn't have it nearly as bad. And I honestly feel a lot of that is because I've had COVID before, so I still have like the antibodies and all of the things. So that probably helped make it a little bit easier. But for someone where you've never had COVID and you feel like you're just on deathbed just because you just feel so miserable. For Danny, it was definitely really, really bad. But I was pretty mild. But between the both of us, I also got the coughing. I also got the congestion. But it's very typical. And I'm sure if any of you guys have had COVID in the past, you know, you get those lingering symptoms that can linger for weeks, like a cough, right? Coughing is usually one of the last things to go, unfortunately. But now, yeah, the last couple of nights, actually the last 2 nights, I think we did pretty good as far as that goes. Because it used to be something we'd wake up in the middle of the night and have like a coughing attack. You get that like tickle in your throat and then you just can't stop.
yeah,
So,
take a deep breath and then you just cough like crazy. But yeah, I mean, here and there, right now where we're at, like, I wouldn't say we're 100%, but we're pretty close. It's just some congestion. I got to blow up my nose and then some cough here and there. Um, we just got to test again to make sure that we're not positive because you tested what, yesterday?
2 days ago.
2 days ago and you were strong
And I was
positive.
still very positive.
I mean,
Yeah.
yeah.
But when he tested, that was on the 28th. That was that Wednesday. And I went through literally the entire week, the weekend and everything with helping you. I started getting some symptoms, but they weren't horrible. And I was like, okay. But then I had tested on the weekend. It was negative. So on that Saturday, I was negative. But then that following Monday, I was positive. And then I've just been positive ever since. But yeah, it's just, and it can last for any of you guys again that know if you've had COVID before, you could be positive 7 to 10 days for COVID. And it can just, it kind of puts a wreck in your plans and stuff too. Cause I know we had things going on and things we wanted to do. And of course, you know, you have to kind of change everything around when you have COVID. But I know we were actually looking at what the CDC now recommends. Obviously, it's very different than when the pandemic first came in 2020, 4 years later. But basically, I mean, once you do have COVID, you need to be symptom free or fever. You have to definitely be fever free for 24 hours. And that means without having taken any Tylenol or any measures. So 24 hours fever free. And or like no symptoms if you're not having worsening symptoms. Past that point, if you're still having some symptoms, then it's just a matter of still doing all the things like we did back in the day. It's washing your hands, it's wearing masks, it's, you know, social distancing and all of that stuff. Because as we know, especially if you're the only one in the household or not anyone in the household or someone else that's sick, you still got to go and get your groceries and go to work or anything like that. But so I think we're pretty close. I mean, we just still need to test negative yet, but
Yeah, I
we'll
mean,
get there.
I mean, technically, maybe I'm wrong when we saw the CDC website. Like, we could go out and about if we want to.
Oh yeah.
I think we're just being a little extra cautious because we don't want to spread it. It's kind of, I think it's rude, you know,
Yeah.
to get other people sick, knowing that if you have it, yeah, I don't think we have fevers anymore. Which is the big one.
No, that's been yeah.
But like, we're not in a situation where we have to leave the house right now. I guess for other people, they have to go to work, they have to do errands, other things, a lot of things going on. So there is that risk, and I get it. And you know, people don't feel comfortable wearing a mask in public because, you know, there's a stigma behind it. It's like, well, I just had COVID, I don't want to spread it. But then, you know, you're gonna have everyone who's an expert saying, oh, you still give it, you still do this, that. So it's hard to be very conscious about it and like,
Yeah.
and just mean well, you know. Like, I get it, life happens, but you still have to go about your day, even if you got COVID. But for us, like, we could still hang out in the house. Like, we don't need to go anywhere. It's right now, especially we're both remote workers, so that helps too. And
Yeah, it helps when you work from home.
so we're very fortunate and lucky in that area. So I don't think we need to go out and about anytime soon. Maybe next weekend we can. I'm sure we'll be negative by then. We might have lingering symptoms like the cough
Still
here and the
lingering.
congestion, but if it's long as it's not like in a position where we're going to be spreading COVID, comfortable leaving the house and doing stuff like that. But again, it's totally not necessary, but if we're able to take that extra caution, why not?
Oh, absolutely. I mean, you just have to be mindful of anyone and everyone around you, the young, the elderly, anything like that. Like my parents, we were supposed to see them, didn't do that. My dad had recently had COVID not that long ago, so we didn't want to do that. My mom had recently just had a surgery, didn't want to have to do any more complications of that. So it's just being mindful. So if you're sick, you have symptoms, you're COVID positive, just stay home, do the best that you can. If you can have anyone that can help you with anything, obviously that's super helpful. But COVID's going to be around, as everyone knows. I mean, it's never going away. It's just doing your part. If you have it or if you know someone that has it, it's just doing the best that you can with the symptoms that it is. And like I said, with this new variant that I've been talking with patients about, especially, and then now that we've experienced it, it's definitely more of like the sore throat situation. So, like we mentioned, all of those different mitigation strategies to help with that if you guys happen to get it. But then, yeah, just take it easy too. Don't push yourself to do too much. The other thing we did too was helping our immune system. So, another thing you can be taking to help is anything like vitamin D, vitamin C, and zinc. So, those are super beneficial. We had Airborne that we took, they were chewables. We took that, and then we now have another supplement that we've been doing that has elderberry and vitamin C and ginger and vitamin D, all of that. So, whatever you can do to just help your immune system fight it off, that's just going to help where you're not going to have the COVID longer. It's just going to help with the healing process and get you better faster. So whatever you can do to help your immune system get it going. So that's the other thing I recommend is any of those kind of supplements. So
If you were to guess, where do you think we got it?
I honestly think from the basketball game.
We went to a Phoenix Mercury game, WNBA game, and it was very crowded. It was packed. It was a
Yes.
packed game because they were against Chicago, so it was a big game. So strong possibility we got it there that Sunday. Because then again, my symptoms were really kicking in. What, 2 days later?
On Tuesday evening, yeah, because this was a Sunday. Yeah.
I mean, we also did go to church, maybe there, right? But we weren't really close to anybody at church. I mean, maybe pass by here. I mean, what's the chances?
Pass
Really?
by, but definitely a lot more closer contact with people at the Phoenix Mercury. Because, you know, when
Oh,
there's a
yeah.
lot of any game, concert, you know, packed house of so many people, definitely is a spreader. So, I mean, anyone and everyone could be walking around with COVID
I
and
think
something
so,
big
too.
like that.
Yeah,
So, yeah.
They pack you like sardines in there, so I guess it makes sense. You know, I'm rubbing shoulders with someone next to me. I had a stranger. There's someone right there in front of me, like
And behind
someone
us,
behind me breathing down my neck. You know, so
waiting in line for things. Yeah, it was very packed. So those are kind of things just to think of if you're going to go to a really big event. If you know you're going to have something coming up you don't want to miss and you got something else going on that you're going to be with a crowd of people, just be mindful. Wash your hands, try not to be as close to people as you can, or I mean whatever you can do, but definitely things like that just make it a higher risk, especially since COVID is still very high right now with the rates. And we're going to be coming to flu season. I mean, everyone forgets about that, but like coming in the fall, I mean, it's going to be flu season and people are going to be sick and there's COVID still going around, and so you just have to be careful. And I know, you know, have fun. I mean, do all the things. We're not saying like don't go do the things. It's just be mindful. If you're going to be in a big crowd of people, just, you know,
yeah.
do all the things like we did during.
Well, I say be mindful as in like if you have COVID and you're sick, I just don't go out in crowds and get other people sick. That's just like not cool. I mean, if you're fine and you didn't know you had COVID and you spread it, that's another thing. But if you like actively know you're sick with COVID,
Oh yeah.
like please do us all a favor and don't spread it anymore. I find that rude. But you know, me working from when I worked at the quarantine station in Hawaii, like people didn't even care. Like it was mind blowing to me how people were super sick and didn't care. They still want to go out and about. They don't care about spreading it. It's just like how is it okay that if you actively know that you have COVID and you spread to other people, like you're fine with that? It boggles my mind when people just think like that. It's so selfish.
Nope, I feel the same way.
Mhm.
Definitely. Being mindful. If you have it, just do your diligence and just stay home, try to get better
Mhm.
until, like we said, you're 24 hours fever free or you test negative, even if you still have symptoms. Just, social distance, wash your hands, wear a mask if you're going to be with around a bunch of people, stuff like that.
I don't
So,
think people are going to wear masks anymore, though. I think it's just too much of a bad stigma now. I think people get way too much pressure and judgment from others who are like, from the people who are like very against COVID when it first came out. So it's like, yeah, I mean, because I don't know. Like, if I were to see someone wearing a mask, I think they're mindful. I mind my own business, but there's going to be other people who are like, take out that stupid mask. Like, just leave them alone.
just mind your own business.
I know.
Do you and
Mhm.
do what you feel is right. Don't worry about what other people are going to say or do. You're doing something that you should be doing. I mean, that's just
Hmm.
my thought.
And the government's also going to be giving out free COVID tests at the end of September.
Yeah, they're going to start doing that, and a lot of it is because of the rise of the
Hmm.
COVID.
Yeah.
Yeah, I mean it's crazy again. So they're wanting to do their part again and trying to make people want to test and make sure, if you're still feeling like those cold symptoms, it's very
Hmm.
much like you have a cold. I mean, sore throat, coughing, itchy throat,
Hmm.
feeling very, very tired, just very lethargic, just anything like that. Like just test because you never know. I mean, that's what we literally thought. He had like a cold, and it was like,
Hmm.
could be COVID. So let's just see.
Yeah.
And it was very positive. So yeah, anytime you feel that way, just even if it's cold related, just make sure you guys test. And especially if the federal government's going to do those free tests again, make sure you get those, order those. They're free, have them delivered to your
Hmm.
house, and then you have them in case you need it to test. So
Yeah. I mean, just to be mindful, because I remember how much are COVID tests now? Because you just
it was like $25 for a kit of two.
wow, just for two tests, that's a
Yeah, it's
lot.
expensive. And then we got like a few of them because we were just
Hmm.
testing like crazy to see how we were doing. But yeah, I mean they can be expensive. So definitely if you can get some free tests, do
Yeah.
it once it's available, like you said. So the end of
Yeah.
the month.
Have free tests, and then when you feel sick, if you feel sick during the winter, then take the test and see if you
Hmm.
have it or not.
Hmm.
But you might want to do it again like 2 days later if you still have symptoms to see if it is maybe your first time. It
Right.
wasn't strong. The COVID wasn't strong enough to get a reading. Maybe 2 days later it does.
Hmm.
Um, but yeah, but it's still out there. Not fun. This variant. I'm not saying like it's like a crazy deadly variant. I think the most deadly types of COVID is behind us now. I
Hmm.
think we're capable of treating it. So like this one, like I said, it's not fun and it's not cool to spread it. But I'm not saying like we need to shut down everything. This is life threatening. Wear a mask again or anything like that. Just be a little mindful that if you are sick and you do have it, just please, I ask, don't spread it.
Yep. Absolutely. COVID's here to stay. So it's whatever you can do to do your part and hopefully feel better if anyone gets it. So
Hmm. But yeah, that was a interesting experience going through COVID. I wish I kicked it faster like other people, but it lasted a while with me, which is unfortunate.
well, then again, like if you were to get it down the road, you have antibodies
Yeah.
now. So
Hmm.
hopefully, I mean, not to say we're hoping you get it again, but if you get it again, you can
Hmm.
hopefully not have it as bad, which is always a good thing.
And I haven't had the vaccine in a while, right? Because it's supposed to wane off, right? I remember when
Hmm.
COVID was first coming out, I got the two shots plus a booster, but that was what, 2021? I've, I,
Oh gosh, haven't had a booster since 2021.
I haven't had a
Oh,
booster
I
because
think.
just from the readings that COVID is not as strong. We have better treatment now. I didn't
Hmm.
really see the need to get a vaccine. I don't know if you've had boosters lately or anything like that.
I did after I had COVID after my valley fever. And that
Yeah.
was a few months after, because of course they do recommend not getting the boosters or anything like that, especially if you were sick. I mean, even if it wasn't COVID related, but if you had any sort of illness, they don't recommend that you get any sort of vaccine for a few weeks to a few months, just depending. But I did get the COVID booster a few months after I had it, after having the valley fever. Haven't had it since. And that was back in 2022. So I haven't had it since, but they are coming back out with a new booster. So a new whatever. I mean, as of right now, but I think it's only being offered once again to the elderly
Right.
or the very, so it's going to go through that before it's general pop. But
Mm-hmm.
there
Mm-hmm.
is going to be a new one. There's, of course, going to be the annual flu shot. I do recommend not doing COVID and flu together because it can overwhelm your immune system if you get them both together,
Mm-hmm.
and it can make you sick, of course, because that might be too much at one time. So I do recommend spacing them. So if you do a COVID, do the flu a few weeks after if that's something that you're doing,
I
just to not
know,
overwhelm.
because I know I've seen it on like from CDC officials, and this is an area I disagree with. And I have a background in public health, but of course I'm not immunologist or anything like that. But just personal experience, like taking vaccine after vaccine after vaccine in the same day, I think, like you said, it overwhelms your immune system. I see it so many times
Yeah,
that people get sick.
I've gotten so sick. And I
I,
hear from other
mhm.
patients that get so sick. So immediately I'm like, just don't do that.
I
I
know
know they recommend that,
they
but
recommend it, but I would say just space it out. But again, who am I? Again, it's one of those things that you do your own research kind of thing. I
mhm.
remember I had back-to-back vaccines because I remember there was when I was living in Hawaii, there was a breakout of I think it's like measles or something. They asked me if I wanted to take the MMR
Yeah.
just as an additional protection. It's not totally necessary, and I was like, you know better than me, and plus flu
Yep.
vaccine on top of that, and then I ended up getting shingles. In my young 30s, I have shingles.
Oh
so,
my God. You got like triple whammy. That's horrible.
so so that was yeah, that was a prime time for shingles to come out because you're so immunocompromised.
Mm-hmm. Mm-hmm.
So it's
Absolutely.
that because of my personal experience of getting back-to-back vaccines, I now space out my vaccines.
Yep. So do I. So
Hmm.
that's just our recommend. Again, you know, obviously they recommend different. I feel like
Hmm.
it's an individual basis of what you want to do. I mean, if you want to do them all, great. Do it all together
Hmm.
if you want. It's just a warning of you might get sick just because it's a little too much on your immune system.
Hmm.
But I also do, I usually, before, if I know I'm going to do a vaccine as well, I will again do boost my immune system. So I'll do some vitamin C, some vitamin D, and zinc a few days before doing a vaccine just to help boost my immune system. So to get it ready for getting a vaccine, which has
Hmm.
helped me. And I haven't been sick since I've done that. And then a couple days after the vaccine as well. So kind of a few days before, during, and a little bit after has been super beneficial as well. So you can try that too and see if that helps avoid you getting sick, especially if you are going to do multiple vaccines at once. So give that a
Hmm.
try.
Yeah, and I pray that like come wintertime, I hope COVID's not like big headlines anymore. I hope it's get going away now. 'Cause it's lingering. It's still out there. It's frustrating to hear about it on the news sometimes. I get it, but gosh, I hope it's not here forever. I hope it
Well,
goes
it's
away.
always going to be around. I'm just hoping it's just going to be something that we do annual. So it's just like flu. It'll be like your
Hmm.
annual COVID shot, and that we have it maintained. We have all the certain different kind of treatments now. We're trying to
Hmm. Hmm.
understand it more and more and everything, which is great versus when we were just throwing everything at it when it first came out. We had no
Hmm.
idea what was happening. I mean, in the hospitals, our protocols changed every single day when it first came out. We had no idea what was going to help or anything. So, I mean, we've definitely learned a lot in 4 years about COVID and the changes and stuff. So, hopefully, yeah, over time, we're just going to understand it better and be able to treat it better and have it a lot more under control. And it's just, it's going to be here. I mean, it's not going to go away. So, we just have to live with it and keep moving on with our everyday life. So,
Yeah, it's another cold, another flu type thing.
hmm hmm
It's another illness virus out there. Can't get away from, unfortunately. But what can you do?
Yep, true. Yep.
Anything else about that experience that we had that we did not mention that we did not cover?
No, it's just, COVID's around. And for any of you guys, I mean, it's so surprising to have someone that has yet had COVID since it's been here for 4 years.
Hmm.
So it was kind of interesting to see his experience having had it after all this time. And now he's
Hmm.
had it. You're like a rarity because pretty much everyone's had COVID at least once now since 2020.
Hmm.
But yeah, it's just do the best that you can when you have it. And just do your due diligence and stay home, get better, and then go back out and do what you got to do.
Yep. But other than that, I mean, thank you very much for doing this video with
Yeah,
me. Appreciate it. Hopefully we can do more. Hopefully,
absolutely.
these are fun.
Good medical topics.
But yeah, that's why I've been out, everyone. I haven't been on because I was just recovering from COVID and just trying to recover. But I'll be back.
Oh,
All right, until next time.
thanks again.
Bye.
Bye.